Health and wellness. What is it and why does it matter? I think there's a common perception that nurses help patients achieve health and wellness, but this isn't always the case, and this PowerPoint is going to help us explore why health and wellness is important and what role it actually plays in nursing. Health is defined as the extent to which an individual or group is able to realize aspirations and satisfy needs and to change or cope with the environment. I think as we kind of explore health, we realize that everyone really has a different definition of what health means to them. It's a resource for everyday living, it's not the object of living. And health is a positive concept emphasizing social and personal resources as well as physical capacities. And it's quite common for people to have barriers to health, and this significantly impacts their care that we provide them as nurses. Next, we have illness and disease, and I think these two terms are used interchangeably, yet they are different. Illness is a subjective experience of less health. And illness and health are seen on a continuum, which means that they're very interrelated, yet they are different. Somebody can have many aspects of health in their life, while an illness makes them feel that they have an experience of less health. Whereas a disease is an objective state of ill health. There is a disease process that we can attach to their health. So there's three historical approaches to health in Canada. And the first one is the medical approach. And this dominated Western thinking for most of the 20th century and had a really big emphasis on medical intervention. They wanted to restore health through medicine. And this included identifying risk factors or precursors for disease. So, for example, hypertension, obesity, high cholesterol, all of these things can lead to the disease of diabetes. And so a medical approach looks at those risk factors instead of looking at the person as a whole and seeing like what kind of lifestyle things might actually be putting this patient at risk for developing diabetes. And so the Lalonde report in 1970s kind of shifted this emphasis from a medical approach to a behavioral approach. And it focused on lifestyle. It focused on people's lifestyles and how their environment and their self-imposed risks and their human biology put them at risk for developing disease. And so they defined health determinants such as lifestyle, environment, human biology, and organized healthcare as these things that could help people's health. Then in the 1980s, we had some criticism of the Lalonde report for insinuating that a person's environment and lifestyle was self-imposed and within their control. And so this kind of shifted an emphasis to the social context and environment of a person. This includes things such as poverty, air quality, poor water quality, and workplace hazards. All these things that people might be exposed to and aren't necessarily within their control and will impact their health. And this kind of led to the Ottawa Charter for Health Promotion, which identifies the prerequisites for health, including peace, shelter, education, food, income, and resources being available to people. So you've already heard me refer to a couple of these documents on the previous slide, and basically what these foundation documents are is that they provide a historical framework for population health within Canada. So first we have the Lalonde report, which was in 1974, and this took the behavioral approach to health. The only trouble with this was that it was later identified that only education and wealthy people were able to do the behavioral modifications required to have any benefit. So in 1986, the Ottawa Charter was developed and it identified the prerequisites for health, and it focused on social justice and equity, so not just the wealthy. In the same year, the EP report created a blueprint for Canada to achieve the World Health Organization's Health for All, and we'll talk about that on the next slide. But this aimed at decreasing inequities and increase prevention efforts to enhance coping mechanisms. In 1998, the Strategies for Population Health came up with something called the social determinants of health. And this is something you are going to see time and time again throughout your nursing career, and is something you're going to become very familiar with. And we're going to focus on this quite a bit in this class, especially. Then in 1997, we had the Jakarta Declaration on Health Promotion and affirmed the Ottawa Charter and added that we needed to empower women. We needed social security and needed to respect human rights and improved social relationships in order to benefit the health of the population. In 2005, we had the Bangkok Charter, which addressed the globalized world. It explored how to do health promotion between disparities in countries, environmental changes, and urbanization. And finally, the Toronto Charter looked again at the social determinants of health and identified that there were certain key aspects to health which have significant impact on people's health, including Indigenous status, early life, education, employment, working conditions, food security, gender, healthcare services, housing, income, and unemployment and employment security. So here we have the Achieving Health for All framework, and this is from the EP report. And so the entire aim of this framework is to achieve health for all. It identifies 3 health challenges, which are reducing inequities, increasing prevention, and enhancing coping. And the health promotion mechanisms to address these challenges included self-care, mutual aid, and healthy environments. And how we were going to implement these strategies and health promotion mechanisms included fostering public participation, strengthening community health services, and coordinating healthy public policy. Finally, we have the determinants of health. You're going to want to know this slide inside out and backwards. This slide has everything to do with health and wellness. The determinants of health are a broad range of personal, social, economic, and environmental factors that not only determine an individual's health, but really the population's health. So we have income and social status. So where is income coming from and how is it being distributed? Your social support networks, who in your life is able to support you through disease and illness and health, education and literacy, employment and working conditions, which include unemployment and employment security, person's physical environment, so geography, housing, and food security. And then we have biological and genetic endowment, individual health practices and coping skills, healthy child development, so early life development. Access to health services is a big one, especially in northern rural communities. Gender, we have culture, so immigrant status, ethnicity, indigenous ancestry. And finally, we got social environment, so your social safety net, social exclusion, and disability. So in knowing what the determinants of health are, how can healthcare implement strategies to influence these health determinants? And one strategy is health promotion. And this is directed towards increasing the level of well-being and self-actualization of an individual. So basically, we're helping someone become a healthier person. So an example as a nurse would be providing patient education on smoking cessation and providing resources to the smoking cessation program that is in British Columbia. The second strategy is disease prevention. And this is where we're taking an action to avoid illness and disease. And it's more focused on the prevention of the disease itself. So this would be you going to get your flu shot to prevent yourself from acquiring influenza. So there's three levels of disease prevention. The first level is primary, and this is protection against the disease before signs and symptoms occur. So an example of this would be the same that I just used on the previous slide, and being up to date on your immunizations, because you're preventing yourself from getting the disease before the signs and symptoms occur. The next level is secondary, and this is taking activities to promote early detection of disease. So we're not completely trying to stop the disease before it happens. We're kind of just trying to detect it early enough. So a great example of this is breast self-exams or pap tests. Then we have tertiary disease prevention, and these activities are initiated in the convalescent stage to prevent progression of a disease. And so an example of this might be implementing a cardiac diet after having a heart attack. So we're doing something to help prevent disease from getting worse, but you are already in a well-progressed stage of the disease process. Now we have the 5 health promotion strategies, and the first one is building healthy public policy, and so advocating for change when necessary. The next is to create supportive environments, so people are going to have their supports needed to live a healthier lifestyle. Number 3 is to strengthen community action, so advocacy trying to support people into healthier lifestyles. The development of personal skills so that people can connect and help other people lead a healthier lifestyle. And number 5 is to reorient health services. So this is to address the needs of the population because they're not always being met. So this cube here represents the population health promotion model. And the top of the cube addresses who. Who are we taking action on? Whether it's a society, a sector, community, family, or individual. The next side of the cube addresses how we can improve health. So these are the Ottawa Charter action strategies or the health promotion strategies that we just discussed on the previous slide. And they include the strengthen community action, build healthy public policy, create supportive environments, develop personal skills, and reorient health services. And the next side of the cube is exploring what we are taking action on. So these are your determinants of health. So what areas of health can be addressed and improved? So income and social status, social support networks, education, working conditions, so on and so forth there. And finally, we've got the foundation of the cube, and this is the why. Why are we taking action to improve health? And it's important that we use evidence-based information that is available to us to make decisions that are consistent with community needs, values, and resources. This is why we aim to improve health. So with this population health promotion model, stakeholders must collaborate to address health determinants. Society is responsible for its members' health status, and health status is a result of healthy practices, social and physical environments. We've moved past that medical approach to health, where we're just focusing on medical intervention. There's so much more to health than a disease process, and it's important to know that when you are trying to promote health with others. Opportunities for healthy living are based on social justice, equity, and relationships of mutual trust and caring. So this kind of speaks to that behavioral approach. We've moved past that approach to healthcare where it's focused on the wealth of individuals and their lifestyle. There's so much more to healthy living. And healthcare, health protection, and disease prevention complement health promotion. And active participation in policies and programs are essential. As a nurse, you're going to take care of some incredible people, and they might have very different views and definitions on health, and that's okay. And it's an amazing experience as a nurse to be able to help people through their journey to finding health, whatever that might be for them.